Hello people, in this video let us look at the value of 1 year of clinical experience after MBBS. This is a type of topic that you probably will not find on YouTube on this day. We are bringing it exclusively for you from MBBS VPAS. So here, unless you're planning to do PG or something else, there is a lot of value for clinical expertise. See, your PG first year itself will become 1 year of clinical expertise for you. So don't worry about that. So you have to be in the hospital treating patients after MBBS at least for 1 year. Your career will get launched very well after 1 year of clinical expertise. So here let me say you should be treating patients, okay? And for this, at the end of the day, you should have 1 year of experience, clinical experience certificate, okay? So did you understand? So this is basically a launch of your career. So you should be treating patients, you should be prescribing medication, and this at the end you should have 1 year, at least 1 year of clinical expertise certificate. I think to prove that you have been employed, you may also need your PF contribution from your employer as a proof. So that I'm not sure that, so it's not just you need the certificate, you may also need to show PF contribution from your employer as proof for further, if you want to apply with this experience elsewhere, you may need this. I'm not sure of this. Okay. So now let us get started. How will you get this clinical opportunity after MBBS? So either you will, some people have rural service, right? So the government itself would have probably taken a bond from you that you will have to serve your community for at least a year or how many ever years. So basically, if that is there, you can take that up. But the problem with that is it is running into a lot of hurdles that the government does not have money, etc. Also, that rural is getting delayed, right? They are not appointing people on time. So you may land up losing time with this option. So now let us look at what other options you have. You can work as a junior resident in your own college or your own hospital or your clinic around you. Just look around, but like I tell you, at the end you should have a 1 year experience certificate, and you should also have a PF contribution. Usually this experience certificate, if it is a continuous of 1 year, I'm trying to write a continuous of 1 year, if it should be. Wait. 1 year continuous it should be. It should not be like you have worked 3 months in one place, 3 months in one place, and 4 months in one place. Does this add up? 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. So it cannot be like you have worked a few months here and few months there and few months there and few months here. That will give a negative impression on your resume that you keep quitting. Okay. So what I'm saying is 1 year, if you can dedicatedly work somewhere, right, as a clinical person, then your resume will hold a lot of value. Okay. So you should have hands-on patient care. Okay. So you should have clinical rotations. You should have real patients, right? That's why I told you have to treat real patients. Don't, if you're writing dummy files and still they are giving you clinical expertise, it's fine. What we are targeting is 1 year of continuous clinical experience certificate, right? This you should have, and your salary credit that you should also show to people as a proof. So it is essential. It is crucial that you should have this, because this will launch your career. Why are we telling you this? There are many job opportunities that will give you a launch after MBBS into non-clinical. Okay. So you can either go into, I'm trying to write non-clinical here, people focus. So you can go into some medical coding or medical transcription, or some jobs are there like that which are non-clinical, right? Non-clinical job opportunities you may get. Content writing, etc. Don't take those jobs up unless it is like a dire need. What I'm saying is focus on clinical expertise, okay? Gaining that 1 year of experience. So now how to get these jobs? We told you either rural or JR. So now let us look at what opportunities you will get after, see here, after 1 year of clinical experience, how exactly your career can take off. It can take off in clinical or non-clinical way. Yes. So clinical, obviously it will take off, that you can always tell. Then non-clinical also, the requirements are that you should have done 1 year of clinical. So this is where the catch is. So the kind of job opportunities that you see in LinkedIn, we are covering this point now. Let us look at that. I think I have the window open here. Like look at this one. Global medical advisor from Novo Nordisk. Okay. So let us, how can I show this part? So this one, you can see here, what they are saying is you should, as an experience, you should be an MBBS or MD in medicine or other branches you're saying, but MBBS if it says 1 to 5 years of clinical experience you should have. Just one, they're saying, right? So 1 to 5 years of clinical experience you should have, and then you can apply for these jobs which are something like a global medical advisor in these reputed companies. Now somebody else needs a medical doctor, right? So for this, again, the years of experience they need is 1 to 3 years. So these are all the clinical opportunities that are there, and non-clinical. After 1 year of experience, people are ready to employ you. Okay, now let us look at some non-clinical opportunities after 1 year of clinical experience. Now look at this one. This is a quality medical affairs professional. This sounds like a non-clinical opportunity to me because it is quality, right? It's not about treating patients. So here they have told you your job description. So this looks like a very quality thing. Data analysis, medical affairs. What is this? So here they are saying that you should have this advanced degree in health science with 2 years of clinical experience, or you should be an MBBS with 2 years of clinical experience. Here they are asking 2. Okay. So here, but in this video, what are we trying to cover? Only the importance of 1 year. So I hope you got the point that clinical or non-clinical, both the roles open up to you after 1 year of clinical experience. Okay, you should gain this 1 year of continuous clinical experience certificate with salary proof. Okay, now let's move on. Let me show you further studies. Now we spoke about job. Now let us look at further job studies also opens up after 1 year of clinical experience. Look at this one. This is an application form to the admission of the Associate Fellow of Industrial Health AFIH course. So if you are not planning NEET PG or something and you want to study further, so look at this. This is from the Government of India, Ministry of Labor and Employment, Associate Fellow in Industrial Health. Basically, this is about industrial health. Here, what they say is, you should see basically what am I trying to say? This is about just a 3-month course actually. This is, see, the eligibility is MBBS degree, and here they say that you should have completed 1 year internship, compulsory internship, right? And then you should have worked 1 year of experience you should have had. Okay, so here it says either that should be very specific to industry or 2 years in hospitals including self-practice. So it can be a self-practice also. If it is a self-practice, people, how exactly will you prove to them that you have been practicing self? Please check those, okay? We will also check those things as to how you can prove that you have been self-practicing in your own clinic. You will have to show your clinic license maybe. So period spent on higher studies after completion of MBBS, okay, shall be considered as equivalent to self-practice for fulfilling eligibility. So if you're doing PG, for 1 year of PG if you have done, that is considered as clinical, what am I saying? Clinical branch if you have taken. Okay, that's what they are trying to say. So basically, did you understand? This program is only for people who have experience. Next, let's look at other possibilities. See, St. John's, other fellowship programs, what I'm telling you is fellowship programs are there where they give importance to people who are doing clinical practice. Okay, so did you understand that? So for further studies like these fellowships or some certificate courses, you should have some experience in clinical, okay? Clinical expertise you should have had, okay? Now I'm moving forward to the next slide. I already showed you the LinkedIn job openings for 1 year of clinical experience. I already showed you this, correct? Then move on. So there are some courses like an executive MBA or a PhD part-time. So this requires that you should have some experience. I don't think they are saying that you should have a clinical experience, but to pursue some courses, even probably MTech, you can check. They need NEET PG score as an admission criteria. They need you to have at least 1 year of clinical experience so that they can consider you as a working professional, so that you can be allowed to do some part-time programs. So you understood, right? See, look at this IIT Delhi notification for PhD. Let me highlight here, like MBBS MBBS, here there's one MBBS, here there's one MBBS, here there's one MBBS. And look at the work experience post the qualification. After your qualification, you should have at least worked 1 year or 2 years for these programs, PhD, 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 correct? So some experience you are supposed to have. But if you have clinical experience, that will give you more opportunities. The world itself opens up after 1 year of clinical expertise or 2 years in some cases, right? So that's all that we wanted to cover, guys, in this video. So the value of 1 year of clinical experience after MBBS is very important. The value is high. So that is what we have to say in this video. Bye bye.